Hi, my name is Emily Rader, and I'm a second year Master's of Occupational Therapy student at the University of Tennessee Health Science Center. Today I'm going to be talking to you about addressing health disparities as an entry-level occupational therapist. Our learning objectives today are that following this in-service, learners will define the term health disparities in their own words, be able to list examples of which groups face health disparities most often, and identify at least one way that they can address health disparities as occupational therapists with future clients. So first we need to talk about what are health disparities. The National Institute of Health defines health disparities as differences in incidence, prevalence, morbidity, mortality, and burden of diseases and other health conditions that exist among specific population groups. So that's kind of a long definition and a bit of a mouthful. So I like to kind of sum it up and think of it as the differences in health and healthcare access among people of different populations. This is important to us as occupational therapists because of our code of ethics and because AOTA, or the American Occupational Therapy Association, released a societal statement on health disparities saying that occupational therapy practitioners have the responsibility to intervene with individuals and communities to limit the effects of inequities that result in health disparities. Okay, but who faces health disparities? So I provided a link to this YouTube video, but as you can see in the screenshot, it's 4 minutes long, so I didn't want to include that in this video, but feel free to pause my video and go watch it, and then you can come back. But I thought that the last graphic they used was a pretty good summary, so I'd like to talk about a few of those points they made now. So as you can see, in the US, there are several population groups that may face health disparities. Socioeconomic status, or SES as they abbreviated it here, may seem like kind of an obvious one and one that we've talked about in several of our classes, but besides just the obvious, cost of insurance and direct services causing decreased access to healthcare, it's important to remember all the indirect factors that can affect health too. For example, food deserts, which are those neighborhoods or areas of town where there's not a grocery store or a place to get fresh produce nearby, and so often people in these areas have to rely on a small convenience store, which carries mostly like prepackaged, overly processed foods. So that can cause decreased access to healthy foods, which can cause, bigger health issues down the line. And also cheaper housing may be in areas with higher crime rates, which can affect a client's physical and mental health, disturb sleep patterns or their daily routines, that kind of thing. Race and racism may seem like another obvious one, and medical racism in particular is a topic that's come up a lot in conversations lately surrounding the COVID-19 pandemic and the Black Lives Matter movement. There is actually a shocking research article published in the Proceedings of the National Academies of Sciences in 2016, which found that about 50% of the white medical students they surveyed answered possibly, probably, or definitely true regarding myths about Black people, such as that Black people experience less pain or that they have thicker skin. So if these biases remain unchecked, it can easily carry over into client and patient care and can lead to decreased quality of care. Unchecked biases may also cause people who are on the LGBTQ plus spectrum to face discrimination, which can again lead to decreased quality of care. And in this video, they mentioned that in particular, clients that are transgender may have a hard time finding healthcare providers who have previous experience working with people who are transgender, and fear of discrimination may lead these clients to avoid healthcare services even when they really need them. For gender, a lot of medical research is centered around male subjects, and symptoms can present differently in men and women, so this can be potentially dangerous depending on the study. The example they used in the video was that heart attacks present differently in men and women. So women may avoid going to the hospital because they don't know they're having a heart attack because we only ever know about the male symptoms. Additionally, men typically use preventative services such as vaccines or annual checkups less, and women may face limited access to reproductive services, and both of these instances can cause bigger problems down the line if they don't catch things early. It's important to remember that a client may have one or all of these factors affecting them at once, so it's important to understand all of these connections. So what can we do about it? Number one is you need to educate yourself. This in-service is just meant to be an overview, and there are tons of resources available, whether it be research articles, books, blogs, videos, podcasts, social media, really just whatever media you like to learn from the most. There's something available. I personally like to listen to or watch testimonies from people who are different than me in some way so that I can learn their perspective, and it opens my eyes to issues that I had never even considered before. And I mean, you can do this just for a few minutes a day. This doesn't have to be like you're taking on a whole intensive course. For instance, in my daily life, I tried to diversify my social media feed by following and learning from people or accounts that offer those different perspectives. And for OT specifically, like the COTAD, AOTA, and TNOTA accounts are great to follow to keep up to date on free online courses or discussions they may offer, just things like that. And number two is going to be active listening and cultural humility. With clients of all backgrounds. So these are two concepts that our classmates have already gone in depth about in their in-service videos. So if you need a refresher, feel free to check those out. But it's good to remember these here too, because every client is a unique person with unique needs. So even if you've worked with someone before with a similar background or situation, your new client knows their own needs best, so it's our job to listen and help in any way that we can, with an open-minded mindset. Number three is know the resources. So knowing the available resources in your area so that you can provide your clients with information about those resources in order to help them bridge that gap. For example, in the Memphis area, we all know the RKS Therapy Center is a good resource for pediatric clients that don't have insurance to cover OT services, which can help to eliminate that cost barrier for clients who may come from lower socioeconomic statuses. And also, just as a fun fact, this picture of our awesome classmates on the RKS board is the first result on Google Images when you search RKS Therapy Center. So I just thought that was neat and wanted to include it here. But anyway, another good example of a resource is that for the LGBTQ plus community, Out Memphis offers a variety of services, and that may be a good starting place or a resource to provide information about for your clients who may be on the LGBTQ plus spectrum. But again, the resources you provide highly depend on your client's specific situation. I do think it's a good idea, though, to go ahead and compile a list of common resources or services that are available in your whatever area you plan on practicing in. So that way you have something just to pull from, and then you don't have to keep doing the same research over and over again. Number four is going to be advocate. So after you've educated yourself, you've listened to your client's needs and discovered and provided resources to your client, it's then time to go ahead and advocate. So this can mean just advocating for your client to the rest of the interprofessional care team. So for instance, if you notice somebody else on the team is hesitant to treat the client for whatever reason, it's important for you to go ahead and talk to your colleague about it so that it doesn't decrease the quality of client care. And if that colleague is not receptive to you, or it might mean that you need to go ahead and contact your supervisor, because it's like that policy of if you see something, say something. And I know this can be like really intimidating, especially as students or soon to be entry level occupational therapists. But our priority is the client. So I encourage you to not be silent when it comes to client care. Advocacy might also mean empowering your client to self-advocate with their current and future healthcare providers. because you're not always going to be there for them or with them, so it's important for them to know how to kind of fight their own battles, so to speak. And then, of course, advocacy might also mean contacting your political representatives as well, like we did recently when we did our advocacy papers in our management and policy course. The AOTA and TNOTA websites are great resources for keeping up with the current advocacy efforts as well, just like how recently we advocated for telehealth and then we got that updated recently to be expanded. And so that's it. These are my resources, and I will provide a reference list on Blackboard so that you can copy and paste these links to the YouTube videos or to the articles if you want to read them further. And thank you so much for watching. Please fill out the attached Google form knowledge check for me, and then feel free to contact me if you have any questions or need anything else. Thank you.